Here at Lincoln University, our department is called the Department of Nursing, and we at this time are a standalone department. So that means that once a student has completed their first and second semester, they can then enter the nursing program. And that would include, the nursing program includes students that are in their junior and senior year. Unless they transfer in, they may have a second degree, but the bottom line, it is that only upper level students can be a part of the Department of Nursing. What we are offering is a Bachelor's of Science in Nursing, and that means that you've had a very strong science background, and during the last 2 years of your training you focus on the nursing skills, the nursing science, based on the foundation of biology and chemistry that you've received in your undergraduate training. We are not an associate's degree program. That is what you usually find out of hospitals and even out of community colleges. The bachelor's will distinguish students. Having a bachelor's degree puts you in the position where your career can actually move forward. Students would not be permitted into graduate school without a Bachelor's of Science in Nursing. They would not even be eligible for promotion within their jobs without the BSN. The way nursing is going, they are asking that by the year 2020 that nurses have bachelor's degree. They want bachelor's degrees. They want the BSN to be the entry level degree to enter the profession of nursing. Once you have the bachelor's degree, it does open it up for you to go on to a master's degree where you could be a clinical nurse specialist or a nurse practitioner, and eventually we hope that you would consider a doctorate or what they call a DNP, a Doctor of Nursing Practice, or a doctorate in another specialty area, combining it with your nursing training. Since people are going to their advisors and the semester is starting, many people want to know whether or not they can major in nursing and or minor in nursing and do another degree as well. The answer is that you can only major in nursing at this point. You cannot minor in nursing. You have to make it your focus. Having said that, I am not saying that you cannot double major. That is completely up to you, and we would support you if you would like to double major. What we would ask is that you complete your initial major before coming to us, and once you enter into our junior and senior training, that you're completely focused on the nursing aspect of your education. So it may take another year, but it's well worth it if you would like to double major. I don't think there's any particular place you can go in this present day and time where you can't find a nurse. So when people normally think about going for a Bachelor's of Science, they immediately think about the hospital setting and graduating, going to work for a healthcare organization, particularly a hospital. Yes, that's where many jobs are, but because times are changing and the emphasis is not on that acute care necessarily anymore, we're seeing more and more acute types of care happening right in the community, right in patients' homes, that nursing is done in the community as well. So whether you're in someone's home, whether you're in an office and they hire you as an occupational health nurse, you can be there to promote health, to help employees get well. There are also specialty areas. Of course, there's pediatrics, geriatrics. There is the mental health aspect of nursing, so that means that you could be an inpatient mental health, or you could be outpatient in the community, you could be in a rehab center. There are medical rehabs that you could also work in where post-surgery but subacute patients are sent. And then there are very unique specialty areas such as space nurses, that's what they call them. They help prepare the astronauts to survive in space, and they also help to make sure they get them back to a healthy state once they return to Earth. So I just gave you some extremes, but there are many different
That's great,
avenues for
especially if you're thinking about double majoring.
Exactly.
Yeah, that's
exactly.
great. That's great.
You must complete the pre-nursing curriculum before we can allow you into the program. So there is no way that we can accept you and then allow you to take courses, pre-nursing courses, once you've been accepted in the program. It really doesn't work that way. You must take your anatomy and physiology, your chemistry for health sciences. It's really important that you take math 110 or higher. Other math courses are not accepted. It's important that you have statistics and of course all of the university cores that are necessary. But we are truly looking at that science and math score. You must pay close attention to your GPAs. It is easy to drop your GPA, but it's a lot harder to pull it back up. In order to apply for the nursing program, you must have a 2.7 GPA and a 3.0 in your sciences. When we say sciences, we're saying math and science. So we're looking at your college algebra, we're looking at your statistics, then we're looking at your chemistry, your biology, your anatomy, and physiology. So please work hard in those courses to keep a B or above. I am really excited. I'm really just excited to be a part of this new department at Lincoln because we serve Lincoln, and Lincoln itself has this wonderful mission to increase the number of underrepresented people that are needed in professions. Our society is extremely diverse, but nursing is not. And when I say it's not diverse, it is in no way diverse. So I feel as if being at Lincoln in an environment where diversity is welcomed and encouraged, that we can actually serve the nursing profession by helping to diversify and provide the society, the people that are well trained, prepared to serve. I'm sorry, I'm so excited.
It's okay.
To serve the underserved populations, minorities, the socioeconomically disadvantaged, people that are willing to go into those areas. And not only willing to go in, but that those people can look up and see people that look like them. We find that in many underserved areas, there is a great distrust for the healthcare community at large. So we're hoping that if we as Lincoln people can actually produce people that can go in and serve these people, provide excellent quality of care, we can improve the society, we can improve the lives of minorities, and hopefully increase the trust and get the education out there so that we have people who are healthier and just able to survive. Our faculty is new. We're a new group and we work together very well. We all have the same focus, and we have a dual focus. Our focus is definitely the patient and it's also the student. And we share a wonderful bond, although we've just been put together. It works very well. All of our faculty members are not only advanced practice nurses. That means that they have advanced degrees. There is no degree under a master's degree in our faculty. 2 are on the road to doctoral preparation, and I'm sorry, make that 3. And they are all certified. Certification in nursing is a step above and beyond your general education preparation. What it says is that you are an expert in your particular field. So all of our faculty members, they have certifications to show that, for example, that they have expertise in nursing education, in leadership, in management, in critical care nursing, in pediatric nursing, and obstetric nursing. So they are highly qualified and experienced educators. All of our faculty, they understand that it's equally as important to be in current practice as it is to be invested in education. So although they are here and they're preparing classes, they're making sure their skills are up to date and they are still active members and direct patient caregivers. So as far as the facilities, we share the Nelson building with all of the science and mathematics and engineering faculty members, which we love. work closely with them. We help to teach some of the labs, for example, anatomy and physiology, some of the bio types of things, and we even have a nurse whose first degree is chemistry, so she also teaches in the chemistry lab. We are well integrated as a school, and we hope that that will help our students going from their foundation training to their nursing expertise. We have a state-of-the-art simulation lab. We have 2 nursing labs. One focuses on nursing skills such as Foley's, sterile technique, suturing, removing sutures, those basic skills, where the other simulation lab allows us to practice skills in close to life situations so that students can get an idea of what it's like to care for a patient before they are actually in front of a real flesh and blood person.
Great.
We have, I'm sorry, I have to add that in not just the simulators, not just the human simulators are there. We have 6. We have 4 human adults. We have a child, and we have a baby and a neonate. A neonate is that newborn, not a month old. So we have the ability to allow the students to experience those acute things that you don't normally have access to.
Sure.
We also have simulated IV arms, and we have electronic medical records, so they'll have experience with that before they even enter the hospital. So everything that we have will prepare them before they even set foot onto a real floor. We do have an agreement with Fox Chase Temple, and our students will hopefully do internships with them, and we're in the process of developing more. For those of you considering nursing, I strongly encourage that you attend our pre-nursing student seminars, and they are designed to help you get the tools that you need that will help you be successful in the nursing program, and also in preparing for the nurse entrance exam. We are using what we call the TEAS test. It's the test of essential academic skills. So in that particular test, they look at your knowledge related to grammar, math, health sciences, and other things. So coming to the pre-nursing seminars will help you to prepare and understand what is needed for you to be able to enter into the program in the junior year. I think that you should stay in communication with the Department of Nursing long before you're ready to take the entrance exam to come into the program. So please come over and visit us. Tour our simulation and nursing labs if you get the opportunity, and come and talk to us. We're happy to answer your questions.